Hi, I'm Dr. Michael Reinhorn. I'm an ambulatory hernia specialist. I'm going to talk to you about what to expect after ventral and umbilical hernia repair at Boston Hernia in that first week after surgery. So really beginning from the third day to that seventh day. This is a time of huge improvements for most patients. By the third day after surgery, your body has started healing. It's reached its maximum pain, and the pain slowly starts decreasing. So that by that seventh day after surgery, most people are no longer taking pain medication of any kind, including over the counter, and are able to walk around and return to their normal non-exercise activity level. So let me talk you through it a little bit more. If you've had a open hernia repair that involves stitching the hole closed with or without leaving a piece of mesh underneath the hole, by the third day after surgery, you should start feeling like you're turning the corner. You will have pain still for the next few days, but that pain becomes tolerable. You may still need to take Tylenol and Motrin around the clock for the days 3, 4, and 5, but generally by the 5th day, you're going to start getting yourself off of any medications for pain. If you've had a laparoscopic repair, the pain lasts a little bit longer, so you may still need that Tylenol and Motrin for that entire first week. You might take an over-the-counter or a prescription pain medication to reduce your symptoms. It's still okay to ice the area. And obviously it's fine to shower. If your pain is tolerable, it's okay to drive and return to work or school. If the pain is not tolerable, then you should still stick around the house. In terms of activity level, we do recommend going outside, going for walks as much as you can tolerate. It's hard to overdo it, but you shouldn't be going out for exercise. You should be going out to get the circulation moving, to get the blood flow. That does help with healing. It can help with digestion as well. In terms of digestion, listen to your body. If you're hungry, eat. If you're not hungry, give your body some time. Depending on the type of hernia you had and what was in the hernia, sometimes there's intestine in the hernia and the body just says slow down. Those intestines need time to heal. Oftentimes people will feel really bloated after surgery. Will feel like there's something inside your stomach. That's generally a slowdown of the intestine as a result of surgery and the anesthesia that was administered. And for that reason, it's just really important to listen to your body. Sometimes that bloating can become from constipation, depending on what medications you got during surgery and whether you've taken any opioids after surgery. Some people tend to run constipated. If you're eating, it's fine to take Colace, Senekot. If you're really constipated, we oftentimes advise our patients to even take some milk of magnesia, and in more severe cases, magnesium citrate. But that's pretty rare. And if you're having that level of constipation, give the office a call. One of the staff members can walk you through or get you one of our clinicians to give you advice as needed. In terms of work and sports, we usually recommend that you can get back to desk type job within that first week after surgery. But if your work requires you do any heavy lifting, any repetitive exercise or manual labor, and you did not sustain a work injury, then typically we require a full 2 weeks before you resume that activity. If you've sustained a work injury, then we start the rehabilitation process at 2 weeks, as the recovery can be quite different. So by the end of that first week after surgery, the majority of our patients are back to work or school. You're able to walk around. You should not need much or any pain medications, but you will feel tugging, pulling, pain with twisting. You're not out of the woods yet, but in terms of your pain, but you should be feeling a lot better.